What would you do if your house was on fire? You'd probably call 911. But what if calling the fire department wasn't cool? What if calling for help wasn't safe? What if calling for help means that you'd get judged? For people with mental health challenges, that's exactly what it's like. And this is because of stigma. We end up having to have secret identities, keeping our pain to ourselves. For mental health, the ignorance is persistent. People used to think that if you had a mental health issue, you were possessed by demons or the devil. So if you were feeling sad and depressed, or experiencing mood swings, or feeling anxious, or having any other mental challenge, it was best to keep it to yourself under lock and key. Because if people found out, you could get shunned from society. How did we learn to treat each other so inhumanely? So in order for anyone to be accepted by society, we all learned how to lie, to say I'm fine, to put up a front, to pretend that we're good even if we're not feeling good. But here's the good news, we don't have to live like we're living in the past anymore. We've learned a lot about psychology, about how the mind works. And we know that there are many factors that can affect someone's mental health. Our mental health is impacted by our environment and by our life experiences. Genetic factors also play a role as well. I want us to be able to call for the help that we need, so that we don't have to deal with our houses burning down alone. It's time to finally end the stigma, because now we know better. And if you feel like your house is on fire, here are some things that you can do. Talk to somebody you trust. And if you're that lucky friend that someone is confiding in, be cool. Know that you're not expected to solve anyone's problems, but allowing that person to be honest helps. I just want to say that help is available, and we don't have to hide anymore. A burning house is a major challenge that humans learn to solve with teamwork, and I know we can do the same with our mental health. It's time to be supportive. It's time to be brave. Let's help each other out.
So, a healthy brain, directs your actions. It contributes to your moods, and it also impacts your ability to think. When we have high blood pressure or we have angina, we use medications to lower our blood pressure. No one questions that whatsoever. It's not a problem. But when I add a medication to make up for that deficiency of that neurotransmitter, so that now my mental health disorder is treated, we think of it differently.
A child's experiences during the earliest years of life have a lasting impact on the architecture of the developing brain. Genes provide the basic blueprint, but experiences shape the process that determines whether a child's brain will provide a strong or weak foundation for all future learning, behavior, and health. During this important period of brain development, billions of brain cells called neurons send electrical signals to communicate with each other. These connections form circuits that become the basic foundation of brain architecture. Circuits and connections proliferate at a rapid pace and are reinforced through repeated use. Our experiences and environment dictate which circuits and connections get more use. Connections that are used more grow stronger and more permanent. Meanwhile, connections that are used less fade away through a normal process called pruning. Well-used circuits create lightning-fast pathways for neural signals to travel across regions of the brain. Simple circuits form first, providing a foundation for more complex circuits to build on later. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, and memory during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. While they originate in specific areas of the brain, the circuits are interconnected. You can't have one type of skill without the others to support it. Like building a house, everything is connected, and what comes first forms a foundation for all that comes later.
It is important to separate mental health fact from fiction. Fiction. A mental illness means you're crazy. Fact. No, it means you have a mental disorder. Using cruel labels such as crazy or psycho only causes pain and discourages people from seeking help. Fiction. People with mental illness can pull themselves out of it. Fact: mental illness is not caused by personal weakness, nor can it be cured by willpower. Proper treatment is needed. Fiction: people with a mental illness will always be ill. Fact: for some people, mental illness may be a lifelong condition like diabetes. But as with diabetes, proper treatment enables many people with mental illness to live productive lives.
We've been saying loud and clear to anyone out there who's hurting, it's not a sign of weakness to ask for help, it's a sign of strength.
And then it's up to us to show compassion, to reach out, connect, help folks find the hope and the support they need. Together, we can change the story about mental health in America. Together, we can change direction.
For non-emergency help, contact your primary care provider, neighborhood clinic, or hospital.